My name is Marina. I am the medical coordinator of the VittoriaVita agency. I am interviewing and engaged in the psychological diagnosis of women who want to become surrogate mothers. Then I accompany them for medical examinations and decide whether a woman can start the program.
My name is Oleg. In short, I will organize full legal support for the surrogacy program.
Well, this technology is not so new. Surrogacy has become possible thanks to IVF. The first successful IVF was conducted more than 40 years ago in 1977. The following year, Louise Brown, the first test tube baby, was born. Surrogacy began to develop in the 1980s. Today, this is a well-functioning procedure. We know how to get maximum eggs from a potential mom or donor. We know how to prepare the body of a surrogate mother for bearing a fetus. We have powerful equipment and technologies that help to select the most healthy embryos. But at the same time, we really cannot guarantee that the transfer will be successful from the first attempt. It is likely that the first embryo transfer will be successful, but it is also likely that a second or third attempt will be required. This is normal and not scary. To succeed, everything must coincide: a healthy embryo, a state of the endometrium, the correct hormonal background. In any case, we always achieve results.
In addition, we have a program that ensures that the couple becomes parents. It is called Guarantee. Its peculiarity is that we make as many attempts of the embryo transfer as it will be necessary for the birth of the child.
If necessary, we change the stimulation protocol or surrogate mother, but always achieve the goal: the birth of a child. This is not true. We only accept couples with medical indications. There are two main factors. First, spouses cannot conceive on their own. They have had unsuccessful attempts at IVF or miscarriage. The second factor is health problems, in which pregnancy can cost the life of a biological mother. For example, a serious cardiovascular disease.
I agree. In addition to medical, there is also legal evidence. Parents can enter the program only if they are married, and this marriage must be recognized by Ukrainian law. Couples from abroad can absolutely legally pass a surrogacy program in Ukraine. After the birth of the child, they receive a birth certificate in which their names are indicated in the column Parents. No, anyone cannot become a surrogate, but this issue has two sides. The law clearly states a surrogate mother may be an adult capable woman without medical contraindications who has her own healthy child. In fact, the agencies establish their selection criteria for surrogate mothers in the framework of the requirements of the law. For example, we accept women from 19 years old and not from 18, as the law allows. The psychologist works with all candidates to determine if they are ready for the program. Also, we do not accept women who had a cesarean section. This is a principled position. In addition, the surrogate mother signs a series of agreements in which she confirms that she does not claim rights for a child. If the woman is married, then she provides the formal consent of her husband.
Yes, that's right. We invite only healthy women from 19 to 35 years old. This is the most effective reproductive period. At this age, a woman can become pregnant and have a baby relatively easily. Potential surrogate mothers undergo many tests and examinations. We have to make sure of two things. The first is that the surrogate mother will be able to bear a healthy child. The second is that pregnancy does not harm her body. It is important that the surrogate mother has her own healthy children. This helps us understand how her pregnancy went, whether there were complications, how the birth went. But we do not invite women who have more than 4 children, since such women have a risk of premature birth. And as Oleg said, we do not accept women who had a cesarean section. I will make it clear, cesarean section itself is not a contraindication to pregnancy and does not harm the baby. Within 2 to 3 years after the operation, the body is restored, and a woman can give birth naturally. But still there is a risk that a second cesarean section may be needed. We try to protect our surrogate mothers, so we try to avoid unnecessary operations. No, Surrogacy is the same as usual pregnancy. The only difference is that the surrogate takes hormonal drugs before embryo transfer. Now I will explain why they are needed. The fact is that during natural pregnancy, the body produces hormones necessary for its development and maintenance. Surrogate mothers have a clean organism. In order for it to accept the embryo, we use hormones to create a favorable hormonal background for pregnancy, same as with natural pregnancy. Plus, surrogate mothers are observed more often and more carefully. In a natural pregnancy, a woman undergoes about 3 ultrasounds and 2 examinations. Surrogate mothers do an ultrasound every 2 weeks up to 12 weeks, then once a month. They also donate blood regularly for testing and other tests.
I can add that for greater peace of mind, you can take out insurance for a surrogate mother.
All information about a person is encoded in genes. Growth, hair color, eye shape, nose shape, all in genes. The child receives this information only from genetic parents. It is encoded in the mother's egg and in the father's sperm. The blood of a pregnant woman and the fetus do not mix. A woman's blood carries oxygen and nutrients to the placenta. The placenta is multi-layered and acts as a buffer zone. In addition, oxygen, trace elements, and vitamins pass through the umbilical cord to the baby.
I can add that after the birth of a child, we will definitely conduct a DNA paternity test.
After 40 years, the likelihood of developing certain defects in the child really increases. Moreover, the risk of their receipt goes not only from women, but also from men. But there are many but. Firstly, before embryo transfer, we perform PGD to eliminate chromosome abnormalities. It is possible to identify chromosomal abnormalities during pregnancy. Between the body of the surrogate and the baby, metabolic processes occur. Therefore, a woman's DNA can be isolated from a woman's blood and also studied. This procedure is called NIPT. It can be carried out already from the 10th week of pregnancy. As a rule, NIPT is performed according to the doctor's testimony, or simply when the parents are worried and want to check everything. Later, the child's condition is seen on ultrasound and screening. As you know, with such technologies, even at the age of 40, you can become the parents of a healthy child.
I want to note that Ukrainian law does not limit the age of biological parents. Even if the potential mother is 40 or 45, but she still has eggs, we can try to conduct a surrogacy program on her own eggs.
Physiologically, physically, mentally, babies are the same as naturally conceived. Moreover, it is likely that physically the child will be even healthier because the strongest and most healthy embryos are selected for IVF.
In no case, in our country, this is impossible. The law states that the parents of the child whom the surrogate gave birth to are genetic parents. That is, a couple who provided their genetic material. A couple can also use donated eggs, but they will be the eggs of a third woman. It is forbidden to surrogate to be an egg donor at the same time. In addition, the surrogate mother signs contracts in which it is indicated that she is not the mother of the child, does not have any rights to him, and does not affect his future fate. Even if something happens to the parents, the surrogate mother cannot take the child. The child is taken by the next of kin, guardians.
Well, in addition, surrogate mothers initially set up their minds to transfer the child to his parents. The psychologist communicates with potential surrogate mothers. The psychologist determines the moral readiness of the woman for the program, and then supports her throughout her pregnancy. There is also the psycho-emotional side of the issue. So that women do not become attached to the child, we conduct a psychological selection. They clearly understand that they are helping an infertile couple and do not claim the rights of the baby. Well, let me remind you that all surrogate mothers have their own children. Often, immediately after childbirth, a surrogate mother is visited by her family. Women quickly switch to their loved ones.
Legally, this is unlikely. Surrogacy in Ukraine is absolutely legal. Mom and dad receive a birth certificate, where their names are indicated in the column Parents. This certificate is a legal basis for issuing a child's passport or other permanent document. Features of paperwork may vary depending on the country, but no one has a legislative or moral right to challenge parental rights in relation to genetically related children. In addition, in Ukraine, in their native country, parents undergo DNA testing, which confirms paternity.